Hello there. I'm Dr. Srishti Mohapatra, and I'm one of the internal medicine consultant and aesthetic physician. And I also lead the research and development wing at India's biggest longevity and aesthetic clinic chain. In this review, it is not just only for the business owners. It is also about the patients so they make smarter decisions and smarter selection of what exactly do they want. The ease of use, the tech breakdown, patient suitability, speed of results, training support, satisfaction, numbers on the costs, financing, profitability. All right, let's talk about one of the minimally invasive techniques that's in and around the market and has taken the entire market by boom. Because again, it is something that can be used for almost every skin type. Apart from the skin type 6, of course, it can be used, but with caution because it has a chance of creating post inflammatory hyperpigmentation on those skin types. Well, we are talking about the game changer machine by InMode, Morpheus8. Okay, so when we talk about neocollagenesis and also triggering more fibroblast growth, that is how it goes with Morpheus. Of course, it's minimally invasive. The depth of the needle can vary across from 1.5 millimeter to 8 millimeter. That is the deepest that any machine is actually reaching. So, by reaching that layer, you're also targeting fat cells. So, how does this work? Morpheus, generally, the needles bypass the epidermis. There's also bipolar radiofrequency, which heats the collagen from 60 to 80 degrees Celsius for immediate contraction of type 3 and type 1 collagen remodeling. Okay, so let's see who are the patients who are actually very good for it. People with moderate laxity and more, but not exactly thin skin, and those who do not have diabetes and hypertension because the healing time is going to be a bit more can be using this machine. Morpheus, the mechanism of action generally lies that the needles go into the depth of 8 millimeter, and the radio frequency in that is a bipolar radio frequency that heats up the collagen type 1 and type 3 up to 60 to 80 degrees Celsius for immediate contraction and creating more fibroblast and neocollagenesis. Now, patient selection. The kind of patients that you would select would be from Fitzpatrick skin type pick 1 to 5, because there are chances of post inflammatory hyperpigmentation and during the healing process that can manifest. And people who want to have a nice jawline, who have fat and double chin, they can also benefit from Morpheus 8. And of course, the laxity is taken care by this. The downtime is a bit more here. You can see the downtime for more than 2 to 5 days, maybe. And you can go back to working within the third day or the second day. There's redness, there's erythema, and of course, there are pinpoint bleeding and microneedle punctures and the square box that you can actually see on your face. Now, people who are not fit for Morpheus are people who are on more than two medications for heart, especially on blood thinners, who are diabetics, not the borderline ones, but people above the HbA1c of 7, because the healing time is a bit slowed for them. People who have a D-dimer of more time. So people with heart or maybe some hormonal healing issues should not be considered very well. They can go for something which is a bit less invasive, something like a derma pen, which is more in control of the depth. Of course, you can control your depth here as well, because the depth can go up to 8 millimeter, but you also have 1.5 to 3, and you can calibrate that on your screen, of course. The tech is amazing because you can see the frequency, you can see the depth of the needle, and it does not need multiple passes. Now, with multiple passes, I mean the microneedling generally takes 3 to 4 passes where you go from a zigzag fashion, then on a hashtag fashion. Here, there's only 40 to 30% of overlap and maximum 50% where you're puncturing each and every time. All right. So when do we see the results? The results here are generally fast. You can see the results with between 2 to 3 weeks, and you can, of course, return to your work, see more tightening. People are going to show up and say, wow, your skin looks great. And of course, the sessions required here are less than what we are expecting with a normal microneedling device. That is 3 to 4 sessions. Generally, a normal microneedling device would take up to 6 sessions to show how effective the treatment has been. And of course, we can see acne scars getting better, your fat going out and redistributing, getting denatured, your old collagen getting away, and new collagen starting to make up. So, this is how it generally works. Per session cost can be nearly about 300 to 600 pounds, depending upon the location and the area where you're practicing. the business to acquire this machine is generally 60,000 pounds to 80,000 pounds. And the ROI is generally from 100 to 200 patients within 9 to 18 months. Of course, it does take time because it is a bit expensive as compared to others which are there in market. But to be really honest about this, if I give an overview, this is one of the machines that goes into 8 millimeter depth. And that is why you can actually use it on lax skins, under your arms, under your abdomen, on your thighs, and that can redistribute the fat cells and it can literally make the skin feeling tighter. So, when we are starting to conclude about Morpheus8, this is something that can actually work for a lot of skin types apart from six. We have to be a bit careful about that. But overall, when we get an idea about Morpheus8, it can work on acne scars, it can work on laxity, it can work on redistributing the fat tissues as well, and also minimizing the look and the bulky look of the face. It can also show amazing results with pigmentation. So it is really one of the bread and butter, which also has radio frequency in it. And of course, patient selection is very important here. But Morpheus 8 has huge number of benefits because what sets it apart is the 8 millimeter depth that no other machine in the market, apart from being having threads or maybe fillers, is achieving. So yeah, it's a go-to from my side.